not doing it anymore anyway. So you get pissed off at me and drop us or something.
We're going live.
Oh. Hey folks, Dr. Joe here. Glad you could join us on our live stream of our Sunday night show. We're in Atlanta. We broadcast from Atlanta. And if you first time tuning in, what we do is I talk to you guys when we're on break on commercials. Otherwise, we're live on the air. So I'll say, I got to go now, and I'm going to run over, and Ahmad, my producer over there, is going to give me some signals, and we'll do it. So if I'm talking in the middle of a question or something, I got to go. We got to stay live because the show is internationally syndicated, and we got to make sure we meet the time clock of all these other stations. So at the breaks, you and I can talk. Now, if you have any healthcare questions, send it in right now. Okay, because what will happen is at the breaks, I'll answer your questions for you. So don't wait. If you have a question, you want to get it in now, because sometimes once this gets rolling, we get a lot of people online because we have Facebook, Instagram, YouTube, Twitch. So we broadcast on a lot of different platforms. So if you have a question, you want to get it in as soon as possible, because once everybody starts sending questions, we may not get to yours. If we don't get to yours, it's not that we're ignoring you. It's just that we had so many questions we couldn't do it. You can always send me your question if you really need it answered. Well, of course, you need it answered through the website, which is drjoe.com. And I'm more than happy to answer your question that way. Okay, we're still good. What do we got, about 2 minutes? About a minute.
Should be now.
Minute 30, actually.
No, it's 7, yeah.
7:06 usually is when we start. So. And, do me a favor, right now, share it. Whatever platform you're on, if you can share the show, share it to all your friends and anybody in your list so that we can get more folks listening and watching, so we can continue to be the #1 live streamed health show in the world, as far as we know. We've looked it up and we can't find anyone else, so I think we're #1. So
I think we're #1.
we'd say it safely.
We can say it.
Somebody tells us differently, we're #1. That's it. I like that idea. Okay, still waiting for us to come around here. This is what we do in the biz. Hurry up.
Water around here.
If I had a water, I may give you one of these. Okay. So I realize I'm a little thirsty today, so ate some Peruvian food for lunch, and it was really good, but it was really salty. I just realized how salty it was. So I'm driving home thinking, why am I so tired? And salty food makes me really tired. And I thought, Mott's doing his cross curl over there. If you're a regular listener to the show or watcher of the show, you'll know what that means. All right, Mott giving a thumbs up. Ready to go live across the nation, across the world. Listen. Weather.
Clear and mild as we head through this evening. Temperatures
maybe snow next weekend.
60s, and by Monday morning down towards a low of 48. It'll be chilly to start the day, and then a high tomorrow of 62 with a mostly sunny sky. On Tuesday, sunny and cooler, low 37, high 50, and then for Wednesday, we'll start near freezing with a high of 48
snow next weekend.
Sky.
64 degrees on
Here we go.
Street at News 95.5 and AM 750.
Go live.
Depend on it.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad you're with us today. Hope you're having a great time. We are, as always. Very interesting show, because what we do is I put together my show topics in advance, and then I'll talk to people, my staff, my patients, Garrett, of course, my sidekick here, and we discuss different topics. And this was an interesting topic, because Garrett and his lady were talking about this before we went on, and they said, we just started learning about this stuff before Garrett started working with you, and now, of course, we're doing shows on it, and it's about hormone-disrupting chemicals. Chemicals that you're being exposed to every single day that are messing with your hormones. Now, a couple of years ago, I was on a cruise, and I was sitting there by the pool, and I noticed something. And I noticed there was a lot of young kids on this cruise, teens, 20s, 30s. And even the guys that were in good shape, they started to look like they were starting to develop breasts. And I thought, that's really kind of strange. It didn't look right. Because I remember, even if in my day, when I was your age, guys, they might get fat, but they didn't actually start to developing breasts. And I'm seeing guys that were actually in shape developing breasts. And that's called gynecomastia. It's a fancy word meaning male development of female-like breasts. And that has to do with disruption of hormones, you being exposed to hormones that are causing problems. So it kind of sparked my thought process. Why is this happening? So I've done a little digging, and this is the research that's out there. Infertility is becoming increasingly more popular, if that's the right word, in recent decades. Now, I've been in practice 34 years. 34 years ago, very seldom did we see a couple come in that couldn't make babies. And now we see it all the time. And in many cases, it's the men. So men, a good portion of this show is going to be geared toward you, but ladies, you need to listen too, because the same thing that's happening to men is happening to women. Total sperm count in North America, Europe, and Australia, and New Zealand, so some of the Caucasian countries, generally speaking, is nearly 60% lower since 1973. So 1973 to 2011, a 60% drop in sperm count. Now, what's interesting about this is South America, Asia, and African countries, or men even, we didn't seem to have that noticeable of a drop. So for Caucasian men, we're seeing a dramatic drop in sperm, 60%. That's real scary. And the worrisome part about that is that trend doesn't look like it's going to stop. It continues to drop. It hasn't leveled out. So if it continues, we got a problem. Well, we have a problem now. So in a nutshell, many men around the world are producing less semen overall. Now let me explain to you how this works. By the way, if you have children listening, we're not going to get dirty or anything. We're going to get a little technical here, but if you're very sensitive about that, this may not be a show for your kids to listen to. But again, it's nothing bad, I promise you. I wouldn't have anything bad on the show here. But what happens is the testicle produce sperm. They travel up a tube, and they go through something called the prostate. Now, the prostate produces a fluid called semen. And then they're mixed together, and then they do their thing. So the semen and the fluid are two different things, but they do mix together and then become one. So we're seeing a reduction in semen and a reduction in sperm count. Sperm counts were from 99 million per milliliter back in 1973. They're down to 47 million in 2011. That's about 60% over about 40 years. That's really scary. 60% drop in 40 years. So in another 40 years, if this continues, we're going to have some issues. Well, the issue will be it's going to be really, really hard to reproduce. And we're going to talk about that and what that may mean to society. Reduction in sperm production is also a warning sign. So guys, it's not just about, hey, dude, I can't make babies. That's okay. I'm cool with that. When you start seeing poor semen, it's linked to other health issues, including high risk of diabetes, heart disease, cancer, and early death. The researchers warn that men are becoming overall less male because it's increasing our risk of diseases, lowering our sperm. Testosterone levels, we're going to talk about that in a second, have dropped dramatically as well. Testosterone have dropped in recent decades, and exposure to endocrine disrupting hormones in utero and beyond appear to be causing this problem. So what we're finding is, gentlemen, it's not only the chemicals you're being exposed to, because you have control over that in your life. It's what you were exposed to when you're in your mommy's belly. So ladies, this is where you come in. If you're of childbearing years, you need to listen to this, because if you expose yourself to endocrine disrupting hormones, we're going to talk about that in a second, or endocrine disrupting chemicals, you're putting your child's health and their life even at risk. And so many times you don't know. And that's what this show is all about. I had a friend of mine, she was looking at a condo the other day, and she said it was perfect. It's everything I wanted. It was exactly what I was looking for. She goes, and then I stepped outside and it was right next to a cell tower. And she said, I've heard you talk about electromagnetic frequencies. I'm not willing to take that risk. It was perfect. She keeps saying, it was perfect. It was perfect. I understand it was perfect. But why would you want to expose yourself to something that has been known to change the molecular structure in your body? If you never heard my shows on electromagnetic frequencies, go to my website, drjoe.com, and we have well over 1,000 hours of audio and video podcasts there, and look up the ones on electromagnetic frequency. Very, very scary what they're doing. They open up, they allow calcium, it opens up the calcium channels in the cells and allows calcium to dump into the cells, and that calcium produces free radicals, and the free radicals are like Pac-Man. They start attacking the mitochondria, which produces energy, and they can attack the DNA. So now we know the mechanism as to how electromagnetic frequencies work. Whether they're bad, the new research shows why it's happening. So that's some pretty bad, serious stuff. But when we talk about endocrine disrupting hormones, you need to know about these, because if you don't, you're going to keep doing the same thing over and over again. All you have to do is avoid these simple things. It's not hard to avoid the endocrine disrupting chemicals. Now, there are some in the world you can't avoid. You ever walk into a store, you smell perfume? Again, a lot of times in the store, you have to walk through the perfume section in department stores. Many times they have chemicals in it called phthalates, and phthalates are endocrine disrupting hormones. So you can't avoid some of them, but there's a lot of them you can avoid. I'm going to give you that information. That's called the tease, getting you excited about this. Endocrine disrupting hormones wreak havoc on us boys. In Denmark, 1 in 5 men cannot father children. That's some scary stuff right there. 20% of men in Denmark can't father children. Folks, when we come back, got to go to break. We're going to talk about what else is happening for these endocrine disrupting hormones, what are the endocrine disrupting hormones, and most importantly, how you need to avoid them if your goal is to get well. Folks, I'm Dr. Joe Esposito. My website, drjoe.com. A lot of good information there. Podcast. Sign up for our newsletter. Just send us your email address. I'll put you on a newsletter list. Follow us on Facebook and Instagram. We do live stream a lot of my shows, so you might want to watch us, and we put those on the website as well. I'm going to open up the phone lines. If you have a healthcare question, any healthcare question, not necessarily about endocrine disrupting hormones, but anything, the phone number here at the studio, 844-44-Dr. Joe, 844-44-DRJOE. Hey, folks, don't go anywhere. I'm Dr. Joe Esposito. We'll be right back. Bam. Okay.
Not a ton of questions yet.
Okay, hold on a second. Ahmad, give me 30 seconds when we start coming on. When we come back on, let me know it's 30 seconds. Phones are lighting up already.
Nice.
Yes.
So we don't have a lot of questions, but we have some deep questions.
The deep thinkers of the world.
One I actually would like to know the answer of.
You don't know it? I
No.
thought you knew everything. Because your girlfriend said you're a know-it-all. That's what she told me. So I don't know if that's true or not.
Whether he knows it or not, he's still a know-it-all.
You still a know-it-all? Okay.
Well, I have Google in my pocket.
That's right. There you go.
So Tammy wants to know what are your thoughts on calcium alginate used on plant-based sausages?
Calcium alginate used in plant-based sausages. Yeah, I mean it's okay. I mean it's not a bad thing. My concern is the other things that are in there. I'm not sure you said it right. And the reason I say that is Garrett and I have this ongoing joke where when he gets a word right, he gets the bell. So I always have to make sure that Garrett's pronouncing things right here. So the problem with a lot of vegetarian sausages, they'll use textured soy protein and they'll use autolyzed yeast. And so textured soy protein, when they do that, you add an acid to soy and it releases something called glutamic acid. And it frees up a lot of glutamic acid. And I did a show a couple of weeks ago on monosodium glutamate. And that's what the bad part of monosodium glutamate is, glutamic acid, which also, by the way, we're going to talk about in a second, disrupts your hormones. So the calcium alginate is not my biggest concern in the sausage. It's the textured soy proteins. Autolyzed yeast also releases monosodium glutamate. So I'm not a big fan of these vegetarian meat substitutes, and they use wheat gluten. Many times they'll use wheat gluten, which of course can irritate the bowels. So that's the least of your concern when it comes to the vegetarian sausages. Now, that being said, I like my vegetarian sausages. They taste good, but I like the new chicken patties. They're not necessarily sausages, but the new chicken patties they make with like a fungus. I won't say the brand name because they ain't paying us to do a promotion for them. But they're made with a fungus type thing, like a mushroom, and they have them vegan now. They used to have them just with eggs. Now they have them vegan. And by the way, I like them a lot, and I feel really good when I eat them too. So I'm not too worried about the calcium alginate. Go ahead.
So the next question, and we really need to just do a whole show.
First, I
dedicated-
have an anecdote.
Okay, go
Tina
ahead.
said that she will always agree with you for.
For anyone that doesn't know, Tina's my assistant.
Yeah, Tina's his assistant, so she's watching, and she's a smart woman. There you go. Agree with the boss when he leaves the room. Go, yes, son of a fucking.
Renata would like to know if I'm saying that correctly.
You don't get a bell for that one.
Probably not.
I'm gonna guess Renata.
Probably not.
Okay.
She wants to know what you think of, or would you explain your opinion on the heart problems of a long-term ketogenic diet?
Well, that's what the research is showing now. Ketogenic.
Ketogenic. He always
You are
tries
not getting bells today, mister.
he always tries to correct me on that
Yes.
one.
So,
If it's just 4 letters, it's keto.
exactly.
Or no, if it's just 4 letters, it's keto.
It's keto? See,
Yeah.
you're the only person I've ever heard say keto before.
It's keto.
Yes.
But if it's a full word, it's
Right.
keto.
Well, the research now is showing that long-term people on the ketogenic diet are increasing the risk of heart disease by about 30-some-odd%. And I covered that in a show a while ago, and I have the research on that. My personal feeling is your body is designed to run on glucose as a fuel. and it can run on ketones as a secondary fuel. The mitochondria can use ketones, and it can work, but I don't think the body is designed to be forced into this unnatural fuel that it can use. I wouldn't say unnatural, maybe not the most usable fuel. And so short term, 2 months or so, people lose weight. It seems to work really well. But long term, we're starting to see some issues with it. And so the exact rationale behind it, I feel, is that the heart is designed to run on glucose, not ketones. But I'm not sure we have all the research now as to why we're seeing the increase in heart disease. So,
Okay, I have one question.
oh, it's coming back. Hold on.
Oh, okay. We'll have your questions after the break, Instagram. Or after the
Yeah,
show.
traffic. All right, let me show Garrett. You're Garrett. He's a mom. You guys look nothing alike. You both got beards, though, you know. Both good-looking guys. You know.
Ahmad shaking his head.
I was going to call you Garrett, but then I said you guys look nothing alike, but you do have beards, so you're both good-looking. That was my cover my butt sentence there.
I don't know. I feel like we could be brothers.
Yeah.
Was that?
I said I feel like we could be brothers.
Your brains were looks.
Possibly. I can see that.
Video. That's why you listen to Dr. Joe Esposito on WSB.
Hey folks, Dr. Joe here. So glad you're there because we're covering lots of good stuff today. We're talking about endocrine disrupting hormones. And this is really important because if you're just tuning in, and I know when people listen to radio and I know when they watch podcasts, they'd always start right at the beginning. And so the bottom line of what we covered before is that from 1973 to 2011, the sperm count in North America, Europe, Australia, New Zealand, sperm count in men has dropped an average of 60% since 1973. That trend doesn't look like it's changing. It continues to drop. And if it does continue to drop, we've got some big problems ahead of us. And it's not just the sperm count. This next segment, I'm going to talk about other things that we're seeing an increase in baby boys. And a lot of it is due, we feel, to mothers exposing themselves to these endocrine disrupting chemicals when they're pregnant. And these endocrine disrupting chemicals, we'll talk about later too, are stored in your fat cells. And so ladies, if you're exposing yourself to these chemicals, even if you're not pregnant, don't plan on getting pregnant, they can store in the fat cells and then over time be released into your body, which can then release it into the baby body. And it causes some real serious problems. I have a lot to talk about. Let's start taking some callers. 844-44 Dr. Joe is the number if you have a question. Marjorie, how can we make your day better? Sure. Okay. You're going to hang up then? Okay. All right. Okay. So overactive bladder. This is very, very common. More often I see it in women than men. Couple of things that we see all day, every day with overactive bladder. Nerves in the low back. I'm a chiropractor. Got to talk about nerves. The nerves in the low back control everything from the waist down. Back pain, leg pain, hip pain, knee pain, ankle pain, numbness, tingling. So if you have those problems, folks, get yourself into our offices and let's check it. Chances are we'll get good results with it. Now, we can't help everybody. Sometimes we have to refer you out to another specialist. But those specialists also refer to us as their specialists because we all do different things. But in most cases, if there's an overactive bladder, number one, we got to check the nerves to the bladder. Second thing is there's actually a way you can adjust the bladder itself. And we go in and we take the bladder and we kind of push on it and then we kind of flip our fingers on it and get the bladder to kind of come out of spasm. And that works extremely well. And I can't tell you how many patients we've had over the years that would just, some cases it's extremely serious. It's painful. And I've had women already come in where one lady I remember said to me, she goes, if you can't help me, I may kill myself because I can't continue living with this pain. And every time I pee, it hurts. And it hurts so bad, I don't want to drink water. And I'm not drinking water. I'm going into dehydration. She goes, and I don't know what else to do. And months later, she got 100% better, started traveling the world again because she was a world traveler. And she would take our supplements, our Super Greens and Essential Source with her. And she would take a picture of it in every country she was in and then send it back to us. She goes, I'm in Russia, I'm in Slovenia, wherever, I'm in South Africa. And it was really cool because we got a lot of publicity from that. But the Super Greens, the Essential Source are imperative for just about every disease known to man because you need the minimum amount of nutrients to get well. Now, I'm not saying it's going to treat the disease, but the body needs more nutrients. And the minimum amount, you get that from Super Greens and Essential Source. If you're not taking Super Greens and Essential Source, you need to start taking it. It's on my website, drjoe.com. By far, our most popular supplements. Now, we have a bunch of other supplements that are all excellent, but the Super Greens and Essential Source, kind of people start there and then they continue on from there. So for enlarged prostate, several things you have to do. Number one, you got to find out why it's enlarged. So I'd recommend getting a medical evaluation for that. Make sure it's not cancer. If it's just benign prostatic hypertrophy, just an enlarged prostate, what you need to do then is get the bad foods out of your diet, the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Second thing is check the low back nerves. That's the nerves that go to the prostate. And then the third thing is for men is use it. It's very important, actually. I know it sounds like a joke, but you got to use it when it comes to the prostate. And you can do things like saw palmetto. Make sure it's a high quality, like any supplement, make sure you're getting the highest quality. Saw palmetto has been shown to help prostate inflammation as well. We have a very good saw palmetto. It's not on the website. It's a different company we recommend. But if you call the office, we can talk about that as well. So for both the overactive bladder and the prostate, you got to check the nerves in the low back. Step number one. Step number two, at the same time, cut out the irritating foods, the acid foods: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And then number three, super greens, essential source, and probably some saw palmetto supplements. That's what I would suggest. All right, how are we doing on time? All right, I'm going to do this segment. If you're on hold, Lee, I see you're on hold too. Hold on. It's a very good question, Lee, so please hang on for me, okay? All right, so I'm talking about endocrine disrupting hormones. And there's a new form of precursor cells for testicular cancer. It was once a rare disease, and that's doubled. So now we're looking at testicle cells and finding out that these testicle cells are morphing into these odd precursors. Precursor cells have begun to develop in a patient before they're even born in some cases. Also, we're seeing an increase in other issues with boys. There's a testicular dysgenesis syndrome, it's called. This doctor from, Denmark coined this thing. So several things that we didn't see a lot of years ago, we're seeing a lot more of. Hypospadias, this is a birth defect where the opening of the urethra, where pee comes out on a man, is not on the tip anymore. It's sometimes on the bottom or on the side. So that's a very awkward situation because when you urinate, it comes out a weird place, but it's a warning sign. It's telling you that there's a malformation in the genitalia. Cryptorchism, this is when the testicles are supposed to, when babies are born, baby boys, the testicles are up inside the body. After they're born, they drop down into the scrotum because testicles have to be at a lower temperature than the rest of the body. And if they're too hot, it can kill the sperm. That's why, gentlemen, sometimes if you're having trouble making babies, you want to wear looser underwear, you want to not get in a hot tub and soak in hot water. And some studies have shown that that might help. It certainly isn't going to hurt because you got to keep the testicles cooler. Oligospermia, this is a low sperm count, poor sperm quality, and an increase in testicular cancer. So we're seeing a lot of problems increasing, and a lot of it, we feel, the scientists, myself included, are due to a lot of the chemicals you're getting exposed to, these gender-bending chemicals. Now, chemical revolution, man, we got a lot of new stuff coming out every single day, it seems like. Thousands of chemicals are dumped into population, and they may be tested individually, but they're not tested in conjunction with you being alive. It's impossible to test every chemical with every other chemical interaction that could possibly happen. So that's a big concern, and it can't be done. So what you want to do is avoid as many of these chemicals as possible. There's a plasticizing chemical called phthalates. It's Phthalates. Phthalates is the way it would sound. And it makes plastic soft and pliable. And so we have a lot of plastic. I'm right down the studio. I'm looking around. I can see so many things made of plastic. The keyboards, the microphones, the cameras, the plastic cups in the background, the plastic water bottles. So we're exposing ourselves to so much more plastic than we ever have before. And many times these phthalates are used in many things, including perfume and air fresheners, but they're used in plastics. And think right now, if you're wherever you are, look around and see how many plastics you're able to look at. 50 years ago, a lot of those plastics didn't exist. And so we're exposing ourselves to these chemicals. Now, these phthalates and these other endocrine disrupting chemicals, there's one called bisphenol A. If you ever heard my shows, you know I talk a lot about bisphenol A in the past. It's an endocrine mimicker. What that means is it acts like estrogen. I'm sorry, it's estrogen mimicker. It acts like estrogen. And so when it gets into the body, estrogen is kind of the antithesis. Got to go to break. Okay, folks, got to go to break. A lot more to cover. If you have a question, give us a call, 844-44-Dr.Joe. When we come back, we're going to talk about where these chemicals are coming from, other chemicals that are messing with male fertility and male hormones, and what it means to females as well. Tell your friends about the show. Don't go anywhere. My website is drjoe.com. We have over 1,000 hours of podcast there. If you want to get your super greens and essential source, by the way, folks, it's a minimum amount of nutrients you need every day. I think you should. Go to my website, drjoe.com. Hey, we're going to be right back.
I'm Nick Soboleski, a select quote agent with a...
There we go.
Okay, what do you got?
I've got one. Their 80-year-old mother is in perfect health, no medication. You're taking magnesium glycinate, 665 milligrams. Is it okay to take, and are there side effects?
Yes, most of us are deficient in magnesium. That's one of those supplements that I did a whole show a while ago on the supplements we're all missing. And that's why the Super Greens, the essential source, is such a great product, because it solves a lot of those questions. Vitamin C, omega-3 fatty acids, which you may need extras aside from this. But we do have the omega-3s from chlorella and spirulina in the Super Greens. Magnesium is one of them as well. And so the answer is yes, keep taking it, absolutely. I think most people, if you're not taking a supplement, you should be, like I said, Super Greens, an essential source will solve the problem. But magnesium is very important. Side effects would be you start getting diarrhea. If you start getting loose stools, you're probably taking too much magnesium. You've reached what's called a bowel tolerance. Your bowel can only absorb so much of anything. Once you get more than that, the problem is that you can get loose stools. So if you get loose stools, then cut back to about 80% of what you're taking, and that should solve the problem. But yes, mom should keep taking that, absolutely.
And then we have one more follower is catching a cold. They have a runny nose. They've been taking the seasonal tonic, and they wanted to know if you had any other tips for fighting it off.
Yes, absolutely. Vitamin D, 5,000 international units of vitamin D a day, always, always, always. If you start feeling under the weather, you can take up to 50,000 international units of vitamin D, but just for 3 days. Then cut back to the 5,000 again. What I would suggest too is nutritional yeast. Nutritional yeast has a type of beta-glucan in it that stimulates the immune system, and a lot of research being used on that with cancer now as well. So nutritional yeast I take every day, vitamin D, 5,000 international units every day. I take the wellness booster every day, and then the seasonal tonic, if you are having a runny nose, I would take that. Oh, I had a real good caller. Just dropped her. Where'd she go? Karen, come back. Yeah, so that's it. And then also raise your body temperature. Because when it's cold, viruses can replicate. Also, if your sinuses are dry, so get a humidifier, at least for your bedroom or your whole house. Humidifier keeps everything moist, so you're not going to grow viruses as well. And also, if you take hot baths or steam shower, I have a steam shower at my house. Take a steam shower, it's going to raise your body temperature, and the viruses can die off. That's why you get a fever when you're sick. It's your body's natural way of fighting off the viruses. So create a fake fever by taking hot baths, and that might help as well. And then stay hydrated. And Super Greens, an essential source, always. If you have questions, folks, send them in right now on your social media way, because we have a lot of different social medias we're running here. So
we're already getting questions, jumping the gun on today's topic.
We always do.
In line with what can be done about reversing the effects of lower sperm count, and essentially what can you do outside of not making it worse than it already is, but what can you do to reverse some of it?
Adrenal support, we're going to cover this, so you are jumping the gun. You're right, but that means you're paying attention, so that's a good thing. Adrenal support, Dr. Joe's adrenal support, I take it every single day. At my age, of course, things are getting weaker. Sperm count is lowering, testosterone is lowering. It just happens when you get older. It's called aging. But the adrenal support is important because the testicles produce testosterone, but so do the adrenals. And in ladies, your adrenals produce your testosterone. So Dr. Joe's adrenal support, along with Super Greens, an essential source. I take vitamin B complex every day as well, and that would help tremendously. Now, if it's a sexual function issue, you might want to consider Dr. Joe's nitric oxide support, because the nitric oxide opens up your blood vessels and increases circulation to all parts of your body. And so if you have more of a drive, that's going to help increase your testosterone levels as well. Use it or lose it. So if you can help the use it part, the nitric oxide is going to be something that's very helpful as well. And you got to stay away from all the chemicals that we're going to talk about in a second. But proactive steps would be adrenal support, Super Greens, essential source, B complex.
Now, what do you think about the effectiveness of collagen supplies and MCT oils?
I worry about collagen supplies because it comes from animals. Okay, if you're doing collagen, now there are plant-based collagen support things you can do, but if you're doing an animal collagen support, it comes from the animals. And animals, even organic animals, store lead in their bones and cartilage, just naturally exposed to it in the world. And if you're doing a bone broth, if you're doing a cartilage support, your chances are you're getting a very high dose of lead into your body, which I'm not a big supporter of. Now, that being said, if you're going to do a collagen support, we use a company called Standard Process, and they all their collagen supports are organically sourced. So the risk of getting any lead or any type of heavy metals is extremely low. So collagen support, call us and we can get you some of the ones we recommend. if you're going to do it on your own, make sure it's organic. And what was the other part of that question?
MCT oils.
MCT oils. Again, it's processed. And oil itself is okay, but it's still processed food. When you start processing the oils even further to pull out the MCT oils, medium chain triglycerides, it's not natural. And so again, short term, 2 months, if you want to do it as part of a ketogenic diet, probably okay. I wouldn't do it long term, though. Knowing what I know and how the body works, I wouldn't do it long term.
And what are your thoughts on kombucha?
I like it. It's very good. The problem is that this is what Lindsay Lohan has affected your life. Who would ever thought you'd hear that sentence coming from me? Lindsay Lohan, one of her alcohol arrests, she went to the judge and she said, I wasn't drinking alcohol, I was drinking kombucha. Kombucha is fermented, it had alcohol in it. All the kombucha in the country had to be pulled off the shelves. Across the country. And now they have to pasteurize the kombucha. So when they pasteurize it, they kill off a lot of the good bacteria that kombucha is known for. So it's okay. I don't have any problem with it. If you make your own, it's better still because you're not killing off the bacteria because you don't have to pasteurize your own. And you can make your own. It's real simple. You get something, it's called what's it called? I can't think of it now. But it's like the mother in a vinegar. And it looks like a giant mushroom. And you can brew your own with just tea, put that in there, ferments its own. So making your own would be the way to do it if you're going to do it. You buy it, it's not bad, but it's not as good as it used to be before Lindsay Lohan came along.
One of our regulars from YouTube says that they gave someone suffering from diabetes and early prostate cancer Dr. Joe's vitamin D. How will this help them?
Vitamin D helps the immune system tremendously.
63 degrees on Peachtree Street.
Save that thought. We're coming back. I like that. It's a good question. Save that thought.
If you're like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-DR-JOE to make an appointment today because so many of you are out there suffering needlessly and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Live and festive in the Publix Holiday
That's loud.
Headquarters studio at WSB.
Hey folks, Dr. Joe here. So glad you're with us today. We're talking about hormone disrupting chemicals and how it's affecting the boys, and we're going to talk about how it's affecting girls in a little bit. But serious stuff. From 1973 to 2011, sperm count in North America, Europe, and New Zealand and Australia has dropped by 60%. And if that trend continues, we're going to have a tough time making babies because the sperm count is dropping dramatically. And then we start adding in women's issues, and infertility becomes a real big issue. Let me take a caller or two here because I got some more things. I want to talk about other factors aside from this bisphenol A and the phthalates that are affecting men. You're going to be surprised some of the things that may be affecting your hormones. But let me take a caller or two. If you have a question, 444 Dr. Joe. And Karen dropped to whoever you were. You had a great sentence there. You want to come back on. Lee, how can we make your day better? Very happy, sir. I hear you fine. Yes, sir. A little loud, but go ahead. Yeah. Yeah. Yes. Oh, I understand that. Sure. Yeah. I've done shows on that already. Yeah. Mm-hmm. Sure. Let's talk about romaine lettuce. Yeah, no, that's actually great. That's why I'm glad you held on. This romaine lettuce concern. Pull all the romaine lettuce off the shelves. Don't eat romaine lettuce. It's the worst thing in the world. You're going to die. Your children are going to have horns. And it was bad. Absolutely. But here's the thing. Romaine lettuce doesn't produce a dangerous bacteria. They get it from being watered with water that was contaminated with livestock waste. So the E. coli that's in the livestock waste, when they go to the bathroom, it gets into the water system. We take that water, they water the romaine lettuce with it, or it got into the water source one way or another. So it's not the romaine lettuce's fault. And I agree, we should have taken the romaine lettuce off. You shouldn't have eaten it. I mean, a very small amount of people got sick. But the problem was because of the animal production that caused the romaine to be poisoned. And absolutely, there's a risk like that. I think we should be warned about it, and we should take it off the air, off the shelves. However, what we need to do is better monitor our animal production. Or, of course, if I had my way, everybody would just eat plants anyway, and we'd be fine. But if you're going to eat animal products, I do recommend you eat organic only, because the non-organic animal products are more likely to be infected than the organic ones, and we're less likely to have the problem getting into the water system. So you're absolutely right. It is a concern, and we are creating these superbugs that are not responding to antibiotics, and I've done shows on that before. So we've got to be careful about that, and that's why taking care of yourself is going to be the most proactive thing you can do. Don't wait till you get sick. Keep your body healthy so you're less likely to get sick. I mean, why did only a few people get sick from this E. coli and the rest of them didn't? Well, I don't know. I'd like to dig a little deeper and find out, did they have a compromised immune system? Were they a special case? Then we got to dig a little deeper. But I agree, we should have taken it off the shelves. So just keep yourselves healthy. Dr. Joe's Super Greens, Dr. Joe's Essential Source, minimum of 5,000 international units of vitamin D every day. Vitamin D3, not vitamin D2. Yeah, and that, yes. Yeah, so what I take every day, and people ask all the time in cold and flu season, because I don't get sick, I take Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Vitamin D, 5,000 international units a day, B Complex, Adrenal Support, and then I take something called Nutritional Yeast every day. Nutritional Yeast is a powder, and it has a certain type of beta-glucan that's been shown to help stimulate the immune system. And in fact, about half a teaspoon a day can reduce the risk of getting the flu by about 25%. So I take it from all angles, and then you got to cut out the sugar. The sugar is the thing that blows out your immune system too. So breads, cookies, cakes, donuts, pastas, got to cut those out too. So, Lee, I think you should try it. Yes. We're getting ahead. You're way ahead of it. You're way ahead of us, Lee. I'm going to cover that in the next segment. So you're right on, man. Love that. That's awesome. All right, my friend. Thanks so much. Appreciate the call. All right. Boy, Lee is a smart dude, isn't he? Yeah. We're talking about chemicals, and he talked about the bisphenol, and he said toys, and absolutely plastics. And a lot of toys, of course, are made with plastic now, so we're going to cover that in a little bit. Other things that affect male fertility. So, gentlemen, sit up and take notice, because it's not just sperm production, it's testosterone. And testosterone is not just your romance drive hormones. It builds muscle. And not just your biceps and your triceps. Your heart's a muscle. Your colon's a muscle. Your blood vessels are muscles. And so when you're exposing yourself to these chemicals, you're lowering your testosterone levels, which can then affect your heart. And I told this story before about my dad, and I won't go into it again, but it's a very sad story as to why I think my father died, actually. Other things, PFOAs. If you use a non-stick cookware, make sure it doesn't have make sure it's PFOA free. Bovine growth hormones. I want to give a shout out to all the dairy farmers in the Southeast. I don't do dairy. I've been a vegan now for 32 years, almost 33 years now, actually. Christmas Day is my anniversary. But they all got together as a co-op and decided not to use something called bovine growth hormone. Now, bovine growth hormone, what it does, it causes the cow to produce more milk than it naturally would. And so the cows produce so much milk that many times the udders become engorged. And when the udders become engorged, they can actually rip and tear. And when the flesh in the udder rips and tears, they get infections. So what they have to do is give the cows antibiotics to kill the infections. And last study, and I don't know, this was a while ago, I don't know if this number is true, but the maximum amount of blood and pus from infections and dripping down, the infection dripping down into the udder, the maximum amount of pus and blood you can have in milk was 750,000 pus cells in 8 ounces. It's about 8 drops. Wow, that's crazy, isn't it? 750,000 pus cells. Makes the milk creamy. So that I had to say it. Sorry. Yeah, Ahmad will no longer be eating his yogurt anymore, will you? See, I see. Just being my producer, he's learned so much here. You know, it's awesome. He used to be an overweight woman, actually. That's how powerful these shows are. He's now a young, good-looking man. That's how powerful it is when he changes hormone levels. Yes, true. It's true. He vouches for me, see? All right, so we're talking about other things that can mess with men's hormones. Monosodium glutamate. We did a show a couple weeks ago on monosodium glutamate. Go to my website, drjoe.com. Great show on MSG and how it affects the body, but it can affect your hormones. Fluoride, pesticides. That's why I personally don't use fluorinated toothpaste. And I have filters in my house to filter out the fluorine out of the water. Because fluoride, I guess, if you put it on your teeth, can help prevent cavities. Absolutely true. However, what do? You don't put it on your teeth, you swallow it. In your water, you swallow it. If you brush your teeth, you swallow it. And if you read the box on your toothpaste, it says, do harmful if swallowed, call poison control. It's toothpaste. What a silly thing to put on there, isn't it? So another thing I want you to think about. Folks, I'm Dr. Joe Esposito. Got to go to break. If you have a healthcare question, lines are open, 844-44-Dr. Joe. That number, by the way, rings through to my offices when I'm not on the air. So if you want to make an appointment to come see us, if you have neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. You are not tougher than your car. I don't care what the insurance company says. Stop suffering needlessly. Every single day, patients come in our offices, the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. And people come into our offices and say, why didn't I do this sooner? Why did I suffer for so long? Stop suffering needlessly. I want you to get well and stay well, so do that right now. You can go to the website and make an appointment, drjoe.com, or you can call us when we're during business hours, 844-44-Dr.Joe. We want to help you get well and stay well. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. We're going to be right back.
Does that sound like you? Neck pain, back pain, shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Hey, Sean Hannity here from Mike.
All right. Sean Hannity got to start right on this mic. Did you know that? How about that? Well, this is a new mic since then, but this spot, how about that? Do you have any other questions?
Definitely this wooden board.
This wooden board. Oh, this wooden. Oh, definitely. Yeah. I think Thomas Edison designed this board, actually. So.
Okay, so back to the diabetes and early prostate cancer patient.
Vitamin D, yes. Thank you. I knew we were somewhere. Yeah, the vitamin D helps stimulate the immune system, so that's very important. And there's a lot of research now with vitamin D and cancer. I would also recommend nutritional yeast because there's a lot of research there as well. You got to stay away from the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Super Green's an essential source. Can help alkalize the system, drive your body to a more alkaline state so the body's healthier there. And with the prostate, I know we joke about it, you got to use it or lose it. And one of the reasons why older men get prostate is because they're not using it as much. So, and to check the nerves in the low back from a chiropractic standpoint, the nerves in the low back control the prostate as well. So if it was me, Super Green's essential source, vitamin D, B complex, and adrenal support is what I'd be taking along with the nutritional yeast.
Dr. Amy will be happy to hear this, but Michelle's been seeing her for quite a while now, and she's had hip pain for about 7 years. Is finally pain-free.
Dr. Amy rocks. Dr. Amy rocks. Dr. Amy's one of our doctors. You what?
She's our newest doctor.
She's our newest doctor, and she just rocks. She's just awesome. And when you come see us, by the way, many times I'll try to meet you for the first visit. But normally what we do is we have you come around. We don't spill water on the board. We might get in trouble. They're funny about short-circuiting the whole board for the whole station, you know. But all my doctors are handpicked by me. They're trained by me. And they're my personal doctors. So if I don't trust them taking care of me, I don't trust them taking care of you. So no matter what office you go to, you're going to be in great hands. People always say, are they as good as you? And I tell them, be honest with you, they're probably a little better than me. Because they know what I know and they know what they know. I don't know what they know. So my doctors are awesome, and all of them are rocking, including Dr. Amy, who got a big shout out today.
I love Dr. Amy.
Isn't she nice? I know. She's
I
wonderful.
usually end up going to her.
Yeah. See, Garrett can go to anybody he wants to. So.
Do you have any questions?
So is alkaline better? I'm guessing alkaline water.
You don't need alkaline water if you have an alkaline lifestyle. Alkaline water treats the symptom, not the cause. I'm not against alkaline water. It's just that if your body's too acidic, you have to ask the question, why? Why am I too acidic? Well, from eating alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, being dehydrated, not eating enough fruits and vegetables, maybe not. That's why Super Greens and Essential Source is a great supplement to alkalize the system. So the body should be slightly alkaline. If you don't believe me, I shouldn't say that. If you want to test yourself, go to a drugstore and get some pH paper. pH paper, it's a little strip of paper, it's probably the size of your pinky, and you're going to pee on it first thing in the morning. Pee a little bit to empty out your urethra, wave it under your pee, and you're going to have a, okay, not me, okay, and you're going to have a color chart, and look at the color chart. You should be about 6.5 to 7.0 the first morning urine. If you're 6.5 or lower, you're too acidic, and then you really need to work hard to alkalize your system.
What is that, like a nice crystal blue?
It has different colors on the chart, and you got to match up the color to it. Yeah. So.
What is ACV?
Apple cider vinegar.
Okay.
Okay.
I was like, huh?
I think arterial cardiovascular ventriculation. Apple cider vinegar.
So that's kind of an easy one. This person tries to use apple cider vinegar, but it just tastes so bad.
It does, doesn't it?
Use it?
Use it as a salad dressing. That's my secret. I don't like the flavor at all. But it's amazing. So what I do is I add it as a salad dressing, and I just put it on my salad. I have a salad at least once a day, and I'll put some apple cider vinegar on it, and then it solves the problem. So there.
Also,
make sure it's raw, organic apple cider vinegar.
Soy is bad now?
Soy's always been bad, and it's getting worse because about 94% of it is genetically modified. Oh, I got to come back on, so hold on. If you're going to do soy, make sure it's organic. Fermented better than not fermented. I hear Ahmad's voice. The voice of God. Ahmad Rashad, that's his name. And you don't know who Ahmad Rashad is because you're too young. Ahmad Rashad was a famous football player.
President of the United States of Health. Now, on News 95.5 at AM 750, WSB.
Hey folks, Dr. Joe here. Thanks so much for joining us. I do appreciate you taking time out of your day to spend with us because I know everybody's busy. But every show, I have one goal. I want to give you information that can help you naturally get well and stay well. And I don't think we've ever done a show in all the 1,000+ shows ever that's people don't walk away. And Ahmad, I think, has attended every one of them and said, wow, I learned something new today. Is that correct, Mr. Ahmad? At least one thing, right? Usually more. Usually a lot more. See? That's right. It really is. And it's kind of funny, when I put my shows together, I think about Ahmad. And I think, okay, what hasn't he learned yet? And so I base a lot of that around Ahmad, because I know if you've listened to all the shows, I know Ahmad's listened to a lot of the shows. So he's the one I kind of, he's my litmus test there to make sure he's learning something new every day. Yes, you did. Thank you. Thank you so much. Continue to contribute. So. All right, so we're talking about hormone disrupting chemicals and what it's doing. We're covering men first. Other things that can mess with your hormones, boys and girls, but this is for men specifically because we're talking about sperm right now. Medications such as statin drugs and antidepressant drugs can affect male fertility. Poor diet, of course, vitamin deficiency. Folks, please, if you're not going to do anything else, at least take Dr. Joe's Super Greens and Dr. Joe's Essential Source. It's the minimum amount of nutrients you need every single day. I take it at least once a day, and if I have a big day, if I didn't sleep well, if I've got a bunch of radio shows, television shows, a week or two ago I had to fly up to New York and be on Dr. Oz show, so that was a crazy little stint there. And so when I do that, I'll take a double dose of the Super Greens and Essential Source. Some of my friends who work crazy, sometimes they work in businesses where it's busy sometimes and slower other times. When it gets busy, they make sure they're double dosing on the Super Greens, the Essential Source. So if you're not taking that at 2 powders, they taste great. I take a scoop of each. I mix it with coconut milk, almond milk. I mix it with water today, actually. And it tastes fine. Get it into your system. You can mix it with a smoothie if you want to. Mix it with frozen banana if you're really sensitive. But stuff is just awesome. And it's the minimum amount of nutrients you need every day. It's fruits and vegetables, prebiotics, probiotics, digestive enzymes, complete multivitamin, alkalizes your system. It's pretty good stuff. And those are all on the website, drjoe.com. Also available on Amazon, too, if you have an Amazon account. Other things that can affect male fertility. We've talked about this one before. Electromagnetic frequencies. Not going to do a whole show on that because I can give you a whole show on that. Go to my website, drjoe.com, and look that up. Being obese, for ladies and gentlemen, let me explain to you what it means to be fat. Now, I used to be fat, so I can say the F word on the radio. I have stretch marks on my chest. I have stretch marks on the back of my legs. I totally get the food addiction. I'm with you. I'm one of you. I'm brethren. What happens is we used to think fat was just a blob. When I went to school a couple hundred years ago, we dissected out the blobs of fat out of the cadavers and said, look at this is fat. It's disgusting. What we've learned since then is fat becomes a living, breathing organ. It gets its own blood supply. It starts producing its own hormones. And guess what hormone it produces? Estrogen. So fat produces estrogen, which essentially counteracts testosterone. So fat produces estrogen. Estrogen causes you to lay down fat, which produces what? Estrogen, which causes you what? To lay down fat. So you kind of, like Elvis said, caught in a trap. So when you're fat, it's hard to lose weight because you're fat. And so this is why it's so important to get on a proper diet. Now we have in our office a 21-day weight loss launch program that we put you on. It's a cleansing program. And for 21 days, we really want to get you strict. We get you on supplements. We get you on a protocol. And after 21 days, you can kind of reset the hypothalamus in your brain. The hypothalamus is the part of the brain that controls hunger. And so it takes about 21 days to go through this reset. And then we put you on a second protocol to help you lose weight. So it's a weight loss program. It's doctor supervised weight loss protocol. And we do it in 2 phases because if you're just dieting, you don't reset the hypothalamus in your brain, you can't get off the addiction. So we got to help you reset that. And if you call the office, 844-44 Dr. Joe, not on the air, you can ask for either Kayla or Tara, and they can give you information about that as well. And that's a really good protocol, actually. Even if you just want to clean up yourself. Maybe you've done too much binging, maybe it was holidays or something like that. It's a real good way to just kind of cleanse yourself and kind of reset your body. But being fat can be a big issue, and it can cause some real serious problems. So these are all things that can affect male fertility. And again, it's not just sperm count, it's testosterone levels. And testosterone levels really worry me because that is so important to your body. All right, let's talk about sources of phthalates. You can get them from ingestion, inhalation, or even through your skin. You can absorb them through your skin. A study from Columbia University first to demonstrate an association between childhood asthma and prenatal exposure to phthalates. Once again, mommy's exposing herself to phthalates. Guess what? It's going to affect the baby. Children born to mothers exposed to higher levels of these certain phthalates during pregnancy had a greater than 70% increase in risk of developing asthma between the age of 5 and 11. Wow. 70% increase in asthma. Who'd ever thought asthma was because your mother was exposing herself to phthalates and other endocrine disrupting chemicals? I'm going to take some callers. When we come back after the callers, I'm going to give you a list of how you're getting these phthalates into your body. You better hang on for that one because that's important. All right, let's start taking some callers here. Will, how can we make your day better? Good man. Sure. Uh-huh. Uh-huh. Oh, sure. Mm-hmm. No, Kratom is, again, for a painkiller, it's good. You just got to be careful because there's not a lot of regulation on its sourcing. So it's kind of the wild, wild west out there when it comes to Kratom. And so a lot of companies say, we have the best. No, we have the best. No, we have the best. But there's no regulation that I know of out there for it. Or a good regulation, I should say. So just be careful you get sourced because if it's a bad batch, just like a street drug, it can cause some real serious damage. So that's why as a chiropractor, and I am board certified in pain management, we try to get to the cause of the pain and not just treat the symptoms. So if it's working for you, once again, I just want to worry about your source. If you want to come see us, hopefully we can find out why you have the pain and then we can get to the cause of it. Okay, well, great question. I appreciate it. And folks, if you do have neck pain, back pain, shoulder pain, numbness, tingling, stop suffering. So many of you would benefit from chiropractic care. And the biggest question I get, it's a rhetorical question, is why didn't I do this sooner? Why did I suffer for so long? And I don't have that answer. Because if you listen to the show, you know you should be coming in to see us. So if you want to make an appointment to come see us, go to my website, drjoe.com, and we can book an appointment in the Atlanta area of offices in Marietta, Duluth, and Stockbridge. And we would love to be your doctors. We want to get to the cause of your problem. We want to work on the nervous system, pinched nerves, muscle problems. We want to work on the digestive system, acid reflux, heartburn, burping, gas, bloating, and we work on your diet. And again, the minimum amount of nutrients are what? Super Greens, an essential source, and all the other supplements, they're on my website, drjoe.com. Hey, don't go anywhere. We're going to be right back.
Your gifts are wrapped and your guests are at the door.
All right, now we got a problem. Ahmad played Elvis. Now Elvis song's going to be stuck in my head all night. So...
All right, I got a few questions. So one, we have a 50-year-old woman wondering what she can do to relieve hot flushes.
Ah, yes, that's a good question. Actually, we have a whole supplement protocol for women. If you call the office and ask for Kayla or Tara, they can tell you the whole protocol there. I have done shows on women's health issues. So if you go to my website, drjoe.com, well over 1,000 hours of podcast there. Look up the ones on women's health issues, and that'll go well into in depth in there. But we have a supplement protocol for you. We can get that for you. Okay.
Okay, and what is the best alternative to cow's milk and why? Like what kind do you
Coconut milk, almond milk, hemp milk, chia seed milk.
Is there any that you don't recommend?
I don't like the soy milk only because I'm not that big a fan of soy. So of all of them, I don't do the soy, but all the other ones are great. People ask me which one do I use. I tell them the one that's on sale. That's how I make my decision. Again, it's not a health food. It's a substitute for cow's milk. Like in a container of almond milk, there's only a few almonds. So it's not like, oh, I'm going to eat this and get a bunch of almond nutrients in me. You're not. Okay, but it's a great substitute. So it's not a bad thing. It's just not a good thing. Like Super Green's an essential source. It's like, but the milk is just, it's a thing.
And what do you think about the claims for high calcium in some of these nut milks?
You don't need calcium. You don't need more calcium. You need less acid. Because if you're eating a lot of acid foods, your body uses calcium to neutralize the acid. So the acid foods are alcohol, meat, sugar, dairy, coffee, soda, and artificial sweeteners. So when you cut out the 7 deadly sins, and on the website, drjoe.com, we have a whole hour, I think it's an hour lecture on the 7 deadly sins. Cut those out, chances are you won't need to take any more calcium. So the added calcium, and many times they add calcium carbonate, which I'm not the biggest fan of, as Garrett knows. So he's learned about that. I have to do liners, so hold on a second.
Okay.
We need to do a contest to see if anybody can beat you in saying the 7 deadly sins.
Some people try.
Fast or faster.
Yes, Julia is very good at it. Julia's one who's very close. So, all right. I got to do these liners because the show's nationally syndicated. I got to do these commercial spots for these shows, and then they air them throughout the week. So, all right. I'm Dr. Joe Esposito. This week we're talking about hormone disrupting chemicals, and men especially, how it's going to affect your love life. Dr. Joe Esposito here. This week on my show, we're going to be discussing hormone disrupting chemicals and gives you the things you need to do to get them out of your life. Hey, we're talking about hormone disrupting chemicals and how serious they are to your overall health. This week on the Dr. Joe Esposito show.
Need to redo that second one.
Oh. Let me redo that second one.
The committee says it couldn't put a 2-loss team into the playoff over a conference champ.
I want to redo the second one.
That's UGA's Kirby Smart on ESPN.
Okay.
So the consolation is the first meeting with the Longhorns since 1984.
Dr. Joe Esposito here. This week on my show, we're going to be discussing hormone disrupting chemicals and how dangerous they are to your health. Boss said I had to do it. I got to do it. I got no choice.
There's just a little slur with the gives.
I was there? Okay, good. See, you caught that. I don't even know it because I don't pay no attention.
All right. We have a 6'2" male. He's 145 pounds.
Okay.
He's always tired and can't gain weight. What can he do?
Okay, that could be a thyroid issue, could be an adrenal issue. I would recommend you come see us and we can send you out some blood work on that. We'd probably want to do a thyroid panel on you to check that out. And we'd also want to do an adrenal panel as well. Now, you may have a digestive issue. You may have an absorption issue. So if you have acid reflux, heartburn, burping, gas, bloating, your stomach could be pushed up against your diaphragm. We may need to pull it down away from the diaphragm. So that's another thing we may have to check as well. But call 844-44-Dr. Joe during office hours. We'll set you up a time, and then we'll do an analysis and find out what's going on. Because it's something aside from just I'm not eating enough, obviously. So.
Okay, and then if we have a little bit of time, what's your favorite way to eat nutritional yeast?
Anything savory. So soup, salads. I put it on my salad every day. I've tried it on sweet things like oatmeal and Super Green's an essential source, mixing it in. Just doesn't work for me. Some people do it. No? You're with me? It has a nice savory flavor. Kind of, I guess maybe like a cheddar cheese almost.
It kind of tastes like cheese flavored chips, like
Yeah,
Cheetos,
yeah.
something like that. It kind of tastes like Cheeto dust.
Cheeto dust,
The only
okay.
problem that I have with nutritional yeast is the smell. If I smell it when I'm going to eat it, it
Yeah.
throws off the flavor.
See, Damon, my office manager, comes in my office every day when I'm eating my nutritional yeast. Like, what the heck died in here?
Yeah.
Yeah.
But
But
such a good flavor. Yeah, it doesn't.
I love it, yeah.
It
What I'll do
smells
too,
like fish food.
one of my quick go-to meals I got to maybe write a whole book on quick go-to meals, you know. I'll take a can of frozen peas, not a can, bag of frozen peas, just heat them up a little bit to defrost them. I'll add a little bit of olive oil, nutritional yeast. Oh, we got time. Nutritional yeast, red pepper, oregano or Italian seasoning, and just mix it up and eat it that way. And it's kind of like a pea casserole for lack of anything else. But it's quick, it's easy, it's cheap, and it's awesome. And many times when I have to bring my own lunch, when I don't have something else planned, just grab a bag of frozen peas, olive oil, nutritional yeast, salt and pepper. Yes.
Instagram will be right back.
Okay, Instagram, don't go anywhere. We're gonna be right back.
Yeah, I need some of these quick meals.
Okay.
Because she's
When I'm not home.
Yeah. She's not home, and you know.
And he doesn't cook.
I love T-Bell for the fact that they don't use trans fats or anything, but there's really not a lot there besides beans and rice. So this is coming from one of the laziest vegans in the world.
I'm going to venture a guess that somebody wrote a book called The Lazy Vegan. If not, we should write it.
I agree.
There you go.
Sounds like a good book title.
Yeah, because like, what do I eat? Yesterday I cooked, so it was raining. So I made a huge pot of vegetable soup, and I'll freeze it. I'll put it in glass jars and freeze it, so I know just take it out and have that. And so that'll be my lunch now for a couple of weeks. Well, not a couple of weeks, a couple of days, I should say. But The Lazy Vegan, I like that.
It's a good one.
Yeah, okay. More questions?
Yes.
Oh, that works for broccoli too, by the way. Frozen broccoli, olive oil, nutritional yeast, salt, pepper, oregano, red pepper. Fascinating. And it fills you up. So it's really good. It's healthy. It's so cheap. I got the bags of frozen peas on sale at a local health food store. They're not paying for an endorsement, so I can't give it to them. I think with the coupon and everything, it was like $1.25 for a bag. So you can get a whole lunch for $1.50, and it's spectacular.
Now, what is the problem with distilled water?
I don't have a problem with distilled water. I like it.
Does it not like minerals?
Yeah, but I mean, you don't drink water for minerals. You drink water for water. You get your minerals from other places because the minerals that are found in water are usually inorganic. So, yeah, it says it's supposed to flush out minerals from your body and stuff. It's so infinitesimally small, it's never a big issue.
Okay.
You know, but it also flushes out a lot of waste products too, which certainly makes it worth it. So distilled water is the best. It's just inconvenient.
Bonnie, I will take that back. I guess the minerals don't matter.
Yeah, I mean, if you eat Super Green's an essential source, you're getting more than enough minerals to replace the tiny, tiny bit that's going to be lost in distilled water. And if you're drinking non-distilled water like tap water, you're getting so many toxins like fluorine and chlorine that far outweighs the benefits that you would get from distilled water losing a few nutrients in there. Hey, your traffic.
When we come back, I'll ask you about Moringa.
Moringa.
Not the dance.
Not the dance. That's the Moringa, isn't it? I don't know. Is that Moringa? What's that called? Is that the Moringa, right?
Yeah.
Okay.
I did some ballroom dancing.
I did too, as a matter of fact. We had patients, and they all came to me as patients. You got to come out ballroom dancing now. And I did. I had a great time. Met some great people. Got my favorite smell ever. A woman used to wear tea rose cologne. Older woman, she's probably 85, 90 years old, and she'd dress up to the nines. And whenever I danced with her, she always smelled so nice. And she goes, "That young man is tea rose." And that's when I started liking the smell of rose essential oil. I don't like the perfumes, the essential oil. So.
The information presented on this program
here we
is
go.
not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad you could make it here. Couldn't get my headset on there. I was getting a little nervous. Ahmad was counting me down. I'm like, I can't get my headset on. So anyway, I'm glad you're here. I'm Dr. Joe Esposito. If you're just tuning in, welcome. Glad you could be here. If you're staying with us, we always appreciate you regulars. Hey, do me a favor. Go to my website and send us your email address. It says, send comments or, contact us. And the reason is we send out a newsletter, not very often. But when we do, it's always good information. Sometimes it's special recipes, sometimes little tips that we don't give out on the show. Many times we'll have specials on our supplements. And the only way you're going to get those is if you give us your email address. We'll never, ever, I promise you, give your email address out to anyone. We've never been hacked. And so we can go ahead and get some good information from you.
Well, they've tried to hack us.
They've tried to hack us. Well, everybody tries to get hacked. I know, right?
We get a lot of traffic.
Oh yeah, we get a lot of traffic. That's
true.
true. Yeah, well, we've never been hacked, right?
Brant's really good at his job.
Yeah, yes, Brant's our IT guy, our website guy. Our IT guy is Josh, who's also very good at his job. But we'll never give out your email address, and so do that. And do me a favor too, follow us on Facebook, follow us on Instagram. We live stream a lot of our shows, and if you are on social media, share the information with your group as well, because we want to spread the word. As far as we know, we're the #1 live streaming show. Well, not only live streaming, we archive them as well on health in the country right now. So we'd love to help you help us. So do that and spread the word. But the website is drjoe.com. If you want to order the supplements, Super Greens, Essential Source, Vitamin D, I'm begging you folks, please get on your vitamin D. 5,000 international units a day minimum if it's not spring or summer. Okay, if you're not out in the sun getting good sunlight, you need to get your vitamin D. So important. The research seems to be coming in almost on a daily basis how important it is. All of those, the B complex, digestive enzymes. Whenever I eat a cooked meal, I take Dr. Joe's digestive enzymes because you need enzymes to help break down your food. If you're eating raw food, you don't necessarily need them as much. But when you're eating anything cooked, and I'm sure all of you eat cooked food every day, you probably want to consider digestive enzymes. We have a great probiotic there. We've got really good supplements in there on the website, drjoe.com. And then if you're not in the area, the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We could always do a Skype consultation for you if you want to do that too. You can just contact us. We'll let you know how to do that. The number here at the studio, 844-44-Dr.Joe, 844-44-DRJOE. Lisa, keep holding for me. I want to go over a list of ways that you're getting exposed to these chemicals, these endocrine disrupting chemicals, which is the topic of the show today. So plastics can release these toxic chemicals, phthalates they're called, and they get into the body and act like hormones. They're endocrine disruptors. So where might you get phthalates in your body? Toys, fast food packaging. Years ago, I used to work for a pizza place. In fact, I graduated college, and I had no money, and I had no patience, and I had an office. And I remember I'd sit there like, well, shouldn't people come in now? I'm a doctor. Aren't they showing up? Well, they didn't. And so I delivered pizza at night. And we learned several things because we used to have to scrape the can, get the sauce out. We had this big giant spatula and scrape the sauce out. It was enough to make one pizza. So you didn't want to throw the can away unless you scraped it. And then now cans are lined with something called bisphenol A. And bisphenol A makes it slippery, lets things slide out. Also pizza boxes. I don't know if you remember, but pizza sometimes would stick to the box. Well, now it doesn't. Why? The pizza boxes and the wrappings that you wrap your fast food in have linings in them, phthalates and other endocrine disrupting chemicals, so it doesn't stick. Well, guess what? Those chemicals can get into your food. Plastic hoses, even medical tubing, and I don't have an answer for that one because sometimes we need plastic tubing, but that's the way to get it. Raincoats and other items, backpacks. These kids are wearing backpacks and it smells like plastic. They're getting these chemicals in their body. Shower curtains, if it smells like plastic, don't do it. Or what you do is if you buy something that smells like plastic, air it out. Put it outside for several days until the smell goes away, and at least that's one way to stop it. Vinyl flooring and wall covering. In my house, there is not 1 ounce of carpet. Everything is hardwood or tile. And if you're going to put hardwood in, make sure that it's pre-finished, that they don't sand it and finish it because it can off-gas, let these chemicals off for about 6 months. So try to get pre-finished hardwoods if you can. Lubricants and adhesives. I've seen this already, and again, we'll try to keep it clean here, but certain lubricants that adults might use have endocrine disrupting chemicals in them. You're putting these lubricants on very sensitive, thin-skinned parts of your body that can be absorbed easily, and they're messing with your hormones. So be careful with that. Coconut oil, by the way, is a good substitute. Detergents. If you have scented detergents, please get unscented detergents. I use the all-natural kind. Of course, I'm a little weird. But get the all-natural kind if you can. It's about the same price. If you've got to do something that's less expensive, please get them unscented. Same thing with dryer sheets. Dryer sheets, by the way, don't soften your clothes. They create a little layer of oil on your clothes that make it feel smooth. And those chemicals that are in there are toxic. Beauty products such as makeup, nail polish, hairspray, and shampoo. I think we're going to do a show on that in the future on nothing but makeup and hairspray and what's happening in there and how nail polish can be so dangerous. We're going to talk about that too. So there's a lot of different chemicals that you're getting exposed to. Now, phthalates have what's called a half-life of about 24 to 48 hours, which means half of it is done or out of your system in about 48 hours, and its whole life is about 96 hours. But the problem is that they can be absorbed into your fat cells and then slowly released from your fat cells. And most people are being exposed to these chemicals every single day. So these phthalates are getting into your system, and it's pretty dangerous. Now, we're going to talk about how phthalates affect the female reproductive system right after I answer Lisa's question. Hi, Lisa. How can we make your day better? I'm happy you're here. Uh-huh. Well, even cookies that are sugar-free, you got to figure out what do we replace it with. You know, flour itself is like eating sugar. So and then it has gluten in it, and gluten's a protein that can irritate the bowels and cause an immune reaction. So if you're going to do cookies, there are raw food cookies. If you go on the internet and just look it up, raw food cookies. In my book, Eating Right for the Health, I have a great recipe for cookies and a pie crust where it's just dried fruit and nuts, and you put it in a food processor and whip it up and then pat it down into a pan, and then you can put some natural fillings in there like sliced apples and the lemon juice. So you can actually make raw food cookies if you want to do it that way. That would be a much better choice. Okay, my pleasure. Yeah, folks, if you don't know about my books, if you haven't read my books, the first one is called Eating Right for the Health of It. Great book, tells you how to change your diet, what to do for breakfast, lunches, dinners, snacks, and also has a bunch of recipes in it. My second book is called Eating Right for the Health of It, and that's a real popular one as well, and it's a whole layout. It's basically what you need to do to get well and stay well. Folks, I'm Dr. Joe Esposito. If you have a healthcare question, 844-44 Dr. Joe. If you want to make an appointment to come see us, and you should. If you have neck pain, back pain, shoulder pain, acid reflux, heartburn, numbness, tingling, if you've ever been in a car accident, the car was damaged, you were damaged, stop suffering. Come to our website, drjoe.com. You can make an appointment in Marietta, Duluth, or Stockbridge. And if you're outside the area, we can always do consultations over the phone if we need to. But stop suffering, drjoe.com, or the number at my studio at the office is 844-44 Dr. Joe when I'm not on the air. Hey, tell your friends about the show. I'll be right back.
Like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering, and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors, and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44 Dr. Joe to make an appointment today, because so many of you are out there suffering needlessly, and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
What would it take for you?
All right. Rockin', baby. Rockin' on the dance floor. How are we doing on time? Good.
Doing great on time.
Okay.
Which I'm sure you have 3 times the amount of information you need for.
I always do. Well, it's kind of nice, though, because as Garrett knows, what we do is we lay out all our show notes, and then whatever we don't cover, we put back into the batch. And we mix it all up again, and then eventually whatever we didn't cover, we cover on shows in the future. So it's always information. And in my car, my boss always laughs at me for this. I have 5 shows laid out, ready to go, sitting in a bag in my car. And the reason is if my boss ever calls me and says, we need you now at the studio, something happened to one of the other hosts, I can be there. And he knows that. And he always jokes about it. He goes, still got those 5 shows? I said, yep. He goes, all right. Good to know. In case I ever need you, I'm there.
One of our loyal followers said, "When will you go do a TED Talk?"
I don't know how to do that. Set it up for me. I don't
We
even know how
should
to
look into that.
Yeah.
It's been filled out. One of the women that worked in my position before I got here had filled one out before.
Okay.
The only problem with the TED Talk is that they want you to do all of that, fly out or go and help support and build a TEDx event, and then no one gets paid for doing it but TED.
Okay.
So there's tons of other places that a great topic or a great talk could be had that will actually compensate you for your time.
Okay. Well, yeah. Because I do lectures that I get paid for them, and I like that. But we're in Atlanta. We should get some TED Talks probably here. What do you think? Georgia Tech or something?
I've had my feelers out.
Okay.
For some of the smaller TEDx events that are around Atlanta. There was one that was supposed to be at Georgia Tech that didn't end up happening. They have to get enough people.
Right, of course. But we weren't booked. If we book it and tell our listeners, we'll fill up the place. So yeah, there you go. Hey, TED Talkers, set it up for us.
So yes, and anybody, by the way, can nominate you to do a talk.
Okay, all of you nominate. There you go. We'll annoy them. So.
Anyhow, I have been slacking on this question from Nancy over here, and I feel so inclined to get this one answered because turns out there is a lazy vegan. She
Does
led
exist.
us on to the cheap lazy vegan.
There you
It's a
go.
woman named Rose who does or has a plethora of easy recipes for vegans.
There you go.
All over YouTube.
Let's hook up with Rose and we'll start putting our shows on her website and we'll share some information. Yeah.
Let's collaborate on a book.
There you go. That's right. Yeah.
So
Co-author it. I'll promote it.
Nancy's question though is, can you touch on fasting, water, and intermittent fasting, and how it helps detox and hopefully release stored toxins?
Actually, Nancy, Tom is on hold right now, and he has the exact same question, ironically. Talk about detox. So why don't we hold off on that, and I'll answer it on the air. How about that?
Perfect.
Okay, there you go.
You got more questions?
Yeah, so Nancy, keep up, because if you have any other questions regarding that when he gets done on the air, I'll make sure to get that in. All right, and going forward, is there a way to reduce... All right, now.
I got the bell. Let's see if he gets it right.
Epidermal cyst naturally without surgery?
You don't get a bell. You don't get a bell.
Yeah, there's like 2 I's and 2 D's. This is a weird one. Epididymal?
Epididymal? Okay. That would be a cyst on the epididymis, which is in the testicles.
Yes.
So, okay. So epididymal,
well,
I'll give you...
It says it's embarrassing enough to go to a doctor, and I hear it's common in men.
Gotta come back. Hold that thought.
Mm-hmm.
I'll give you 1 bell for getting it right the second time. Okay.
Southbound from exit 14, Highway 20 down to McFarland Parkway, 2 left lanes blocked. Delays have lessened, though, quite a bit in the last hour or so. Earlier crash, Highway 138 westbound at 75 now has all lanes blocked while they load the record. Get that out of your way.
It's amazing, isn't it, how
Downtown
fast this show goes?
right now.
It is.
3 more segments, and that's it.
Either direction between Atlantic
incredible.
Station and Langford Parkway. Jill Nelson, WSB.
If you think your best years are behind you, you're wrong. Listen to Dr. Joe Esposito every week on WSB.
Hey folks, Dr. Joe here. So glad you're with us today as always. Thank you so much for tuning in. I do appreciate you taking time out of your day, and thanks for telling your friends about it. Because every week, every day, our website gets so many hits, and more people like us on Facebook and like us on Instagram. And on Instagram, it's interesting. I didn't know this. They told us if you get like 10,000 followers, then what happens is you get a check mark next to you, and apparently that makes you legitimate. So everybody listening, go to Instagram, like us or follow us, and let's get up to that 10,000 mark, and so we can spread the word even more. And you can help, so you can be part of the show. How cool is that? So we're talking today about hormone-disrupting chemicals, endocrine-disrupting chemicals, and what happens to the body. I talked a lot about men and how it affects sperm count and testosterone. Let's talk about women for a second. Your endocrine system are the part of you that produces the hormones, and they influence every cell, every organ in the body. And this is why endocrine disruptors such as phthalates have such dire consequences, because they affect every cell. So your endocrine system, it regulates your mood, your growth and development, your tissue formation, your metabolism, your sexual function, your reproductive processes. And after 34 years in practice, I see a lot more of these issues coming up than I ever have before. 34 years ago, as a chiropractor, I saw people with neck pain and back pain, and they came in and they got adjusted, and most of them got amazing results, and they told their friends, and the practice grew, and it was wonderful. Now, I'd say we have, a good portion of our patients are still neck pain and back pain and car accidents and sports injuries and workers' comp injuries. But I see more and more patients coming in with specific issues. I've got a hormone issue. I can't lose weight. I've got acid reflux, heartburn. Many times with acid reflux, we need to adjust or pull the stomach down away from the diaphragm. And that's kind of a neat thing. Oh, Tom hung up on us. I was going to answer his question for him. So, Tom, if you're listening, I'm going to answer your question for you because somebody else called that question in as well. So we're seeing more and more questions and issues coming in about not necessarily directly chiropractic, what you would think is a directly chiropractic related question, but also people are more aware now that chiropractic is a heck of a lot more than just neck pain and back pain. It's a whole healthcare system to help get the body well. We work on the nervous system, the digestive system, and your diet. So we're seeing more and more women and men coming in with these big issues. Here's one for you, ladies. Women with the highest levels of phthalates in the urine began menopause 2.3 years earlier than women with the lowest levels. So, ladies, you don't want to hit menopause too early because that's a warning sign. Some may enter menopause as early as 15 years earlier. So if your phthalate levels are high, it can be affecting a lot of issues. So there can be some severe consequences for women's fertility, especially as women wait to have babies. So I'm going to wait until I'm more established in my career, maybe my early 30s, my late 30s, maybe my 40s. If you have this endocrine disrupting hormones in the body, you got problems. And it could mean that it may be too late for you. So there's another reason you got to do it. All right, other things that may affect it, and I'm going to go back to the caller. So Karen, hold on there for a second. Scientists have linked phthalate exposure to attention deficit disorder, breast cancer, obesity, type 2 diabetes, lower IQ, autism spectrum disorders, neurodevelopment disorders, behavioral issues, imbalanced hormones, of course, we talked about that, liver cancer, altered thyroid function, and miscarriage. That's just some of the things that's linked to. So you got to be careful about that. And we talked about this earlier, how sperm count is dropping dramatically, especially among Caucasian men. From 1973 till 2011, it's dropped 60%. And if that trend continues, fertility treatments might soon become the norm. And I didn't see a lot of fertility treatments 30 years ago, and I'm seeing more and more people. And it's becoming a cottage industry in the healthcare world that more and more doctors are opening up fertility clinics because men and women are having trouble making babies. But I'm going to give you something here that's going to scare you men. Time to cover it? Yeah, let me cover this. Let me see. Sperm count zero. GQ wrote an article called Sperm Count Zero. Dire prediction that childbearing may soon become a privilege of those who only can afford it. It's true. If you can't afford fertility treatments, well, you're probably not going to be able to make babies if these trends continues. So as it continues, we know it's going to be hard enough to conceive. It's getting harder and harder to conceive because of all these issues. And it's going to be expensive, so it may not be an option to a lot of couples. It may only be for the rich folks. Now, there's a technology. Gentlemen, listen to this. Ladies, cover your ears. I don't want you hearing this. New technology called IVG, in vitro gametogenesis, is showing early promise where they can, in 2016, Japanese scientists created baby mice by fertilizing normal mouse eggs with sperm that was created from stem cells from other women. They're taking the stem cells and creating sperm out of it, which can mean, gentlemen, there is no longer a need for men. They don't need us anymore. The girls in the studio just giggled. Yay, finally. So, but if that happens, that's a real serious, it's a warning sign about society that we have to now create these laboratory babies. And that kind of worries me. All right, let's start going to callers here. If you have a question, 844-44 Dr. Joe. Karen, how can we make your day better? I know, Karen, it's scary, isn't it? Well, the good news is this show tomorrow will be on my website, drjoe.com, so you can listen to it over and over again.
I'm off the grid there, so
Good. Okay. Good. Okay. Right. Oh, wow. Okay. Yeah. What do we do about a torn rotator cuff? Okay. And if he has got diabetes as well, have him go to the website. If you're listening, go to the website, drjoe.com. Look up my shows that I've done on diabetes. Listen to those shows over and over and over again. Because the studies now on type 2 diabetes is that many of them can be controlled with diet and supplements. Most, as a matter of fact, a major majority of it can be controlled. And studies now, many doctors in the area saying now, if you do all this other stuff, chances are you won't need the medication. And type 2 diabetics, it can be deadly. Obviously, your friend's arm is so cold because it's a circulatory issue. So for torn rotator cuff, depends how bad it's torn, to be honest with you. But we see them all the time in our office. And a couple of things. From a chiropractic standpoint, we check the nerve supply in the neck, because that's the nerve supply to the shoulder. So you got to make sure you're getting nerve and blood supply to the shoulder. Number two, we check to see if the shoulder's dislocated, because chances are if the rotator cuff tore, it also dislocated. So we need to set the shoulder back into socket, which is very simple. We do it all day, every day. And then we can do some trigger point work, and then we got to get good diet. I would take Super Greens, an essential source. I'd probably recommend nitric oxide to increase circulation. The vitamin D, again, across the board, you need vitamin D as well. And the B complex to help the nerve supply heal. And then as a diabetic, I would also recommend something called Gymnema. Gymnema can help stabilize your blood sugar. And if you have sugar cravings, I tell people this all the time, chew a Gymnema caplet. It doesn't taste very good, but that's not the reason I want you to chew it. When you chew it, when you eat something sweet, it has no flavor. So it's really a cool little supplement, and a lot of people do this when they have sugar cravings. So, and everything except the Janine is on the website, drjoe.com. If you want to make an appointment for him, just go to website, drjoe.com. We'll get him set up. Okay? Excellent. Cinnamon's also very good for diabetics. Got to go to a break, Karen. Thanks so much. Folks, I'm Dr. Joe Esposito. If you have a healthcare question, 844-44-Dr. My website to order supplements, make appointments, come see us in Atlanta, Marietta, Duluth, and Stockbridge. The website is drjoe.com, or call us during business hours, 844-44-Dr. Hey, don't go anywhere. A lot more to come. We're going to be right back.
Hey, Sean Hannity here from my friends at Renter's Warehouse.
Going to 80s with this music.
I know, man. I like it. Picture me in my long hair, my pointy gray plastic shoes, and my Don Johnson gray jacket.
Picture me as a nothing.
That was it, see? See, it's funny, like people dress like they're in the 80s. I was like, it's my closet. I don't know, what do you mean you're dressing for Halloween as an 80s person? It's how we went out every night.
What's scary is that 70s show was made like...
In the 90s?
Yeah, it was made just as far back... Like, it's just as old as what we could make of that 90s show.
Exactly,
now.
that 90s show, right, yeah. Mm-hmm. Yeah, man, it was all there. I remember it well.
All that.
All right, so we've only got, one more break after this?
One more break after this, yes.
So lightning round.
Boom, go.
Thoughts on Moringa?
Moringa's great. A lot of antioxidants in it, good source of vitamin C. It's good. It's not the end-all be-all, because if you have a good diet and super green's an essential source, you don't need the Moringa. But it's a good product, yes.
And the... Epididymal,
yes, cyst.
Without surgery.
Without surgery. What I'd recommend is really straighten out your diet, because a lot of times cysts can heal. I'm looking at you. I should be looking at the cameras, right? I'm talking to you. You just ask the questions. When you straighten out the diet and alkalize your system, and then from a chiropractic standpoint, check the nerves in the low back, because that's the nerve supply into the testicles. And you want to get the nerve supply working. You want to alkalize the system. Super green's an essential source. Vitamin D, nitric oxide for circulation. Probably some probiotics as well, in case there's an infection in there. We got to help wipe out that infection. And I think you'll be pretty happy.
You don't want to squeeze it?
No. Yeah, you squeeze it. Yeah, see what kind of faces you make.
What are your thoughts on Kratom?
We did that already.
We already went over that.
You don't pay attention.
You just did Kratom?
Yeah, you asked it.
Oh.
No, you didn't.
You're right. No,
it was a collar, yeah.
It was a collar.
Yeah, I worry about Kratom because it's not really regulated, so you might be getting some cheap junk. It's kind of like street drugs, you don't know what you're getting. So I don't have a problem with it if it's really good stuff, but we don't know if it's really good stuff or not. So somebody sent me samples one time. It was like in a twist bottle. It wasn't sealed or anything. I was like, I'm not going to do that. So
in line with today's topic, nuts. Better soaked or unsoaked?
Soaked.
Soaked. Why though?
Breaks down the phytic acid, and the phytic acid and the enzyme. There's an enzyme. There's a chemical in there that prevents the enzymes from breaking it down. It's called a protease inhibitor. And so it's nature's way of saying, if you're going to eat me, I'm not going to let you digest me very well. So when you soak it, you break down the protease inhibitor, and the protease inhibitor allows the protease, the enzymes in your body, to break them down more effectively.
Okay, I have a few questions.
Let her go.
That I've been waiting for a long time. Okay, they said how many vitamin C drops should a 5 or 6 year old take, but I think they meant vitamin D.
Vitamin D, for adults, about 5,000 international units. So to kind of base it, on a half of an adult size, probably half the drop. So maybe 2 or 3 drops a day is fine.
Okay, and then one other quick question. Somebody wants to know, why does their head spin every time they're around people who wear perfume?
I was trying to make a head spin joke, and I don't know, I just couldn't put it all together. My brain wasn't working that fast. The perfume has chemicals in it that go right into the olfactory bulb, into the part of the brain, and the olfactory bulb can then affect, if you're actually getting dizzy, it's affecting where things are in the brain. If it's close to it, it can affect it. And the olfactory bulb is kind of down under here, and it's not too far from the cerebellum, and the cerebellum controls balance. So it's probably it's affecting the olfactory bulb, which then goes into the olfactory part of the brain, which then affects the cerebellum.
So then, following up with that question about perfume, is it less dangerous or okay for you to spray perfume on your clothes while you're not wearing them and then wait for it to dry and then put that on? Or would that still add the same
It's still going to add the chemicals. It's going to be better because it dissipated a little bit. Why don't you just get some essential oils and use the essential oils? You get all those wonderful smells. They're much more natural. I hate perfume. I can tell you story after story about how perfume is like even I went to a christening, and a lot of people at this christening had perfume. They want to hug me. Oh, it's Dr. Joe. Because when you hug them, what happens? You touch them, you stink, and you can't wash this stuff off. And so if you're going to use essential oils, just use that. It's much more natural for you and the other people around you. So.
All right, your turn.
Okay, what are your thoughts on the old school mushroom powders? Is it necessary to take that along with the super greens and essential source?
I don't think so, no, but they are good for the immune system. So they do have the same type of beta-glucan that the nutritional yeast has in it. So that's why they work so well. So nutritional yeast and the mushrooms kind of do the same thing.
If you have a problem with yeast and candida, can you still eat nutritional yeast?
Yes, different type of yeast, yes.
Now, what is a good source of PEAs besides chocolate?
Sweet potatoes.
And what does PEA stand for?
Phenylethylamines.
Ah.
See? Sweet potatoes are also very high in PEAs as well as chocolate. So you can give sweet potatoes on Valentine's Day. See how far you get with that one, cowboys. You're not going to get very far.
By the way, I greatly appreciate acronyms. They help me out a lot.
Ah, good. See, we had somebody in here who called up before. I wanted to come back. She said, thank you for such an amazing job you do. And I wanted to put her on the air, and then she hung up on us. So whoever you are, come back. Baby, come back. Band called Player. Way before your time.
And you know what?
What?
Nick here said, he's doing his laundry right now, and he was about to put the dryer sheets in.
Awesome.
Stopped.
Someone saved my life tonight. They're going to do songs now. They're going to do song titles now and how it relates. So Elton John said it. Someone saved my life tonight. Throw those dryer sheets out, Nick.
Okay, so Dr. Joe, I ordered from your website the adrenal supplement, and the label stresses to contact my doctor before use. How safe or risky is the supplement? When I read the benefits on the website, I was encouraged to purchase it and try.
We have got to put it on there because the FDA makes us do these little warnings. Unless you have super, super high blood pressure, I've never known anyone to have an issue with the adrenal support.
Yeah, so the only product that we really, really need to talk to your doctor about is the nitric oxide.
Nitric oxide, if you have high blood pressure, really, that's the only issue, yeah. Mm-hmm. And actually, the super greens and the essential source have vitamin K1 in it. So if you're on a blood thinner, tell your doctor about that as well, because they got to modify your medication if you're taking the super greens, the essential source.
All right, now this person was told not to eat raw or too much fiber because of small bile blockage from scar tissue that wrapped around the base of the stomach.
Yes.
What veggies can I eat without going?
If you cook the veggies, it's going to break it down and make it easier. But if you come in and see us, we may be able to adjust the stomach down away from the diaphragm. Maybe that can help free up some of that scar tissue and bowel blockage. And then you can get onto the raw food. But the super green essential source gives you all the raw food benefits without the fiber. So make sure you're on that.
How do I fix the pH in my bottled water?
And keep you well. How do you fix the pH in the bottled water?
In the Publix holiday headquarters
I don't know.
studio at
Don't drink bottled water, I guess. We got to go back. Hold on. Get me next time.
True independence comes from feeling good and staying out of the doctor's office. Get stronger and healthier with Dr. Joe Esposito on News 95.5 at AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're there. I love having you guys along with us today. Really good show today. Well, all the shows I think are good. We're talking about hormone disrupting chemicals and how it affects men and women, and how it can affect women being able to reproduce, how it can bring them into early menopause, how it can really mess up your hormones, and you really got to stay away from these things. So let's talk about things you need to do to avoid a lot of these issues. So there's generational effects on the phthalates and the endocrine disrupting hormones, because what's happening is if parents are exposed to it, gentlemen, it can lower your hormones, it can lower your sperm count, it can lower your testosterone levels. Ladies, if you're exposed to it while you're pregnant, it can get into the uterus and cause real serious issues. And that's the new trend. This is starting to become the norm. I mean, look at what's happening with our children. The Moody Blues, and there's a line in the song that says, and I'm frightened for your children. And I am frightened for your children. Because think about this, when I was a kid, autism, 1 in 6,000. Now, 1 in 40. New Jersey, it's 1 in 35. New Jersey wins, man. You guys have done a good job of having the most autistic children per capita. So a lot has changed. And it could be a lot of different things. But a lot of it has to do, I believe, with our environment and the chemicals and the toxins that we're exposing ourselves and our children to. Now, it's virtually impossible to steer clear of all the sources we're going to talk about, but I want you to minimize your exposure the best you possibly can. Before we go into that, let's take a call. If you have a question, 844-44 Dr. Joe. Jim, how can we make your day better? Yes. Yeah, nutritional yeast. Yeah, it's got to be nutritional yeast, it's called. It's also called brewer's yeast. Now, they don't really sell brewer's yeast anymore because brewer's yeast actually was a byproduct of beer. And when the beer was brewed, it was left over, but it was so bitter that you really couldn't eat it. So now scientists have found a way to grow the brewer's yeast. It's called nutritional yeast now. And they use bacteria to grow it, and it doesn't have all that bitterness, but all the nutrients are there as well. So there's a certain There's a certain type of beta-glucan that's found in nutritional yeast. It's also found in certain mushrooms, and it can stimulate the immune system. Now, a while ago, I said it's also found in oatmeal. I was wrong. It's a different type of beta-glucan that's found in oatmeal. It's still good for you, but it doesn't stimulate the immune system. So nutritional yeast and certain types of mushrooms are great. Now, nutritional yeast is a powder. One of my staff said it kind of tastes like like a cheese powder on the bottom of a bag. If you eat chips that have a cheesy flavor to them, and yeah, it tastes great. It's loaded with B vitamins, loaded with amino acids, and it's a great source of this beta glucan. So I use it every day, and you don't have to use a. There is no wrong nutritional yeast. So nutritional yeast is the one you want. Most of them are supplemented with B12 because most of us are deficient in B12. Well, a lot of us are deficient in B12. So make sure it has a good amount of B12 in it if you're going to pick one. But any type of nutritional yeast will be fine. My pleasure, Jim. And nutritional yeast, folks, is a nice savory flavor. So I've tried mixing it with super greens and essential source. Don't like it. But on salads and soups, anything savory. Popcorn, if you get organic popcorn and you spray on, you can spray on a little like amino acids, it's called, because if you're going to use soy sauce, it might have monosodium glutamate in it. But you can use a vegan butter if you want to on the popcorn and then sprinkle on nutritional yeast, and it's just spectacular. And once you start using it, you're just going to love it. It's just so good. And relatively inexpensive. I mean, it's expensive to buy, but you're not going to use a whole lot of it either. So, per serving, I know this research they did for the beta-glucan was a quarter of a teaspoon. I think it was 4 cents to help reduce the risk of cold and flu in children by about 25%. And if they did get sick, it reduced the severity of it by about 25 to 50%. So it's pretty good stuff. Now, also, we have something talking about immune system called Dr. Joe's Seasonal Tonic. Now, Seasonal Tonic is if I do feel a scratchy throat coming on, if I do feel like I'm going to get sick, it's ginger, horseradish, cayenne pepper, onion, and garlic pureed in apple cider vinegar. It tastes the way it sounds, like a really strong salad dressing, I guess. But it's nice because it's antiviral and antifungal as well as being antibacterial. And many times if you have a viral infection, antibiotics don't work on viruses. They only work on bacteria. So you can take antibiotics and wipe out good bacteria as well as bad bacteria, and it can actually make the viral infection worse because it weakens the immune system long term. So that's why a lot of scientists now and doctors are looking for alternative treatments to treat viruses, germs, and bacteria because we've created these superbugs, things like MRSA, that aren't responding to traditional antibiotics. They've become too strong. They've mutated. And so the viruses, germs, and bacteria haven't really been exposed to things like garlic or oil of oregano. So now a lot of doctors are mixing this in with their healthcare treatments and their healthcare regimens to help people fight off infections. And so if I feel an infection coming on, I will take the Seasonal Tonic. I also take Wellness Booster every day in the winter because it helps stimulate my white blood cell production. It's echinacea, pau d'arco, olive leaf extract. And so it's one of those preventative things I do. I take vitamin D every day, at least 5,000 international units of vitamin D. And the Dr. Joe's brand, it's only 5 drops. I take super greens and essential source, which is the absolute minimum amount of nutrients you should be taking every day. I was at a party, in fact, last night, and somebody came up to me and says, "Oh, I listen to your show all the time, and I've been meaning to get that super greens and essential source." Well, folks, don't mean to get it, just get it. Go to the website, drjoe.com. If you want to pick it up at our offices, saves you shipping. We don't want to charge you shipping. Well, I've got to pay the post office or, our shipping companies. So if you come by the offices, you just pick them up. And then we get to meet you too, which is kind of nice too. We have offices in Marietta, Duluth, and Stockbridge. So if you have questions about that or when the hours are, you can go to the website or call the office at 844-44-Dr. And if you want to make an appointment, come see us, 844-44-Dr. Joe. Again, we're a team of chiropractors, neck pain, back pain, shoulder pain, and we work very closely with our medical colleagues. We have general practitioners, dentists, or orthopedic surgeons, neurosurgeons, vascular surgeons. We co-manage so many cases. Hospitals, nurses send us patients all the time. We have discharge nurses as they're discharging the patient say, "Listen, go see Dr. Joe and his team so you can follow up and get well so we don't have to see you again, which is kind of cool. So all that, the information's on the website to make appointments or get the supplements, drjoe.com. But what I do is I take the vitamin D3, Super Greens, Essential Source, Wellness Booster, and Nutritional Yeast every single day. And then I eat a plant-based diet anyway, so I'm getting lots of vitamin C. That's another one we're missing in there as well. But that's the protocol I take every day to keep my immune system strong. And it's always cool when I get my blood work done, the doctors are like, wow, you got the blood of like an 18-year-old. I was like, no, most people my age have rotten blood. Their average, they're not normal. When I donate blood, they look at my blood and they say, your blood is so red. It's amazing. And it comes out so easily. That's normal. It's not average, it's normal. What's average? We take 100 people, divide them up, divide by 100, and that's the average. I don't want to be average. I want to be way beyond average. I want to be normal. And that's what's so cool. And it's kind of fun because people always peg me for about 15 years younger than I am, and I take every compliment I can. So I'm perfectly fine with that. So it's kind of fun. Nobody ever guesses my age. And is it worth it? Yeah. I mean, do I miss sometimes, meatball sandwich? I don't eat meat. I don't even think about meat as an option. But I remember how much fun it was eating, the standard American diet. Think of what that spells. SAD, the sad diet. So, gotta go to break. Oh, and Ahmad even knows my Moody Blues song now I was just talking about. So, folks, gotta go to break. One more segment. If you have a question, give us a call, 844-44-Dr.Joe. That'll get you through to the studio. That number rings through to my offices when I'm not on the air, 844-44-Dr.Joe. Make appointments, folks. Stop suffering. Bring your family, bring your friends, and bring your kids. Because when we get a kid healthy, they heal a lot faster than us old folks, and it gives their life a better jump start. And you can do that, 844-44-Dr.Joe, or on the website, drjoe.com. All the supplements we talk about and a lot more are on the website as well, drjoe.com. We have over 1,000 hours of podcasts on the website, audio and video. You can download them, watch them, whatever you learn, however you learn best. It's all on the website, drjoe.com. Follow us on Facebook, follow us on Instagram. We live stream a lot of our shows. Tell your friends about the show because we want to naturally get you well and keep you well. When we come back, ways to avoid the chemicals. We'll be right back.
Does this sound like you? Neck pain, back pain, shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Last segment.
Okay, I have one quick question before. This was off of when y'all were talking about the supplements last break. Does nitric oxide elevate blood pressure?
Decreases it. It opens up the blood vessels, increases circulation to the body, but it also helps lower blood pressure. Yeah.
Okay, and there's only a couple of questions left.
Good. We only have a few spots left.
Do you take your supplements all together, or should you space them out?
Take them all together. And the only reason I say that is you can space them out, but if you space them out, your chance are you're going to forget to take them. So I just take them all at once. Big handful, swallow it first thing in the morning.
And I answered this one for you, but what did you say earlier? Was it 5,000 international units?
5,000 IUs, yes, which is 5 drops of Dr. Joe's vitamin D with K2, yes.
And now, what can you do about nausea? What are some of the causes? What supplements can be taken? And
nausea.
Note that the person is not pregnant.
Not pregnant. Well, that's, of course, the first question there. Nausea, nausea is usually from the vagus nerve. The vagus nerve comes out of your neck, comes down the left side of your body, goes into your stomach, and controls all the organs in your abdomen except your adrenal glands. Why it doesn't control adrenal glands, I have no idea. But the vagus nerve, if it's being irritated, can cause that nausea feeling. That's when you start rocking back and forth. You get seasick. And the vagus nerve goes up. It can affect the inner ear. It can also affect the cerebellum. So if you have nausea and dizziness, we got to look at the inner ear and the cerebellum are the two places we got to look. So we do a test. It's a real simple test called a Romberg's test. We have the person stand still with their feet together and close their eyes. And with their eyes closed, we watch them to see if they start to sway to one side or the other. If they start falling to the left, it's a left-sided cerebellar issue. If they start falling to the right, it's a right-sided cerebellar issue. And then we adjust them on just that side of the body, the side that they fall to, because it sends a neurological burst of impulse up into the brain to stimulate the cerebellum. Then we can actually adjust the ears, because it may be ear canal issue. So I always want to look at the vagus nerve when I start seeing nausea to find out why the vagus nerve is being irritated. So you could have acid reflux. The stomach could be pushed up against the diaphragm. Could be a spasm of the ileocecal valve. Had a patient 2 days ago with that. And once we fix the ileocecal valve, that helped the nausea. So we got to find out why. And then we look at the food too. You may be eating bad foods that can cause nausea as well. So it could be a lot of different things, but we have a plan laid out for getting it fixed.
We used to do that balance test for concussions and football.
Exactly. Yes, because if you damage one part of the brain, you fall to this weak side. Yeah. Mm-hmm. I know that's stupid. We have a sport. I played it too. And how much damage we cause to our bodies. You know, we have to have regulations on how hard you could hit somebody. Don't play it. God, I wish I never played.
It's just like boxing.
I actually had somebody ask me the other night. They were talking about how one of their fingers is the knuckle is permanently swollen. I was like, yeah, well, both of my I pointed them out. So I said both of my middle fingers were broken at the same time.
Yeah.
Playing football.
Yes. Yeah, it really is insane. And for what? What good did it do us?
I don't know. I got to flick my coach off, actually.
He said, my finger hurts.
I had to show him.
I know. I never got to date any cheerleaders. I mean, you know, why did I even do this, you know? Gosh. What else you got?
I think that's actually, we had an earlier question on YouTube that I missed.
How dare you?
Bad boy. Bad Gary.
Hello, Dr. Joe. I suffer from gout. I was taking uroloric medicine, but I stopped taking it because it made it worse. What can I take holistically to help me?
Okay, so gout, the nitric oxide would help circulation. The super greens essential source can help alkalize the system. So that's what I would suggest. We have to go back soon. But you got to avoid fructose because fructose converts into uric acid in your liver. So you got to give up not just meat, you got to give up the fructose as well. And no one ever talks about that with gout. But once you cut out all the fructose, and that's breads, cookies, cakes, donuts, pastas, regular sugars. So cut out all the sugars in your body, even fruits. And once because fructose has to be converted into glucose, and in the process, uric acid is a waste product, and uric acid prevents nitric oxide production, which you need for circulation. So certainly the nitric oxide.
How do you do that so fast?
Do what? Oh, like
while I'm looking at Ahmad, while I'm looking at the questions on the board, while I'm putting my headset on. Some people can play basketball. I got a good brain. I really have to say I was just blessed with an amazing brain, and that's my parents. Good genetics.
Help future by looking at your refrigerator. Learn what you should eat and what not to eat to get healthy. Dr. Joe Esposito is on News 95.5 at AM 750 WSB.
I am so glad that you're with us today. I am Dr. Joe Esposito, and really, once again, another great show. And if you're just tuning in, you missed an amazing show. We have this the last segment, so we still got another 8 or 9 minutes here. Actually, 7 minutes and 20 seconds. But if you go to the website, drjoe.com, we have well over 1,000 hours of podcasts stored there, audio and video. You can download them on SoundCloud. You can watch the videos. Follow us on Facebook. Follow us on Instagram, because we do live stream a lot of these shows. We do it on YouTube as well. And so you can watch them if you want live, or you can certainly watch them later on if you want to on the website, drjoe.com, which is a great website. And I have a blog there. Send me your email address so I can put you on our newsletter. We send out a lot of good information. Sometimes we have special breakout lectures just for people on our newsletters, and we invite them, like a pop-up lecture type thing. And those are always a lot of fun. Garrett sometimes gets crazy and puts a lot of supplements on sale. He doesn't tell me about it because I yell at him when he does. But he's a little sneaky, the devil, that Garrett. And you can then get information about the supplements as well. But we'll never give out your email address. Don't worry about it. We're good there. So if you want to get the supplements, Super Green, Essential Source, Nitric Oxide, B Complex, the vitamin D3, we talked about that, probiotics, the Adrenal Support, those are all on the website too, drjoe.com. All right, last segment. We've got to do this. How to minimize your exposure. Keep this in mind. Avoid plastic food containers and plastic wraps. Store food and drinks in glass containers instead. In my pantry, if you go in there, I've got 2 shelves of nothing but glass bottles. And whenever I make extra soups or whatever I have my Super Greens and Essential Source. I shake them up every day in a glass jar. So yeah, you want to save all your glass jars. You don't have to buy anything. Just as time goes on, when you use a glass jar, rinse it out, wash it out, and save it. It's good for recycling. It's good for the environment. You save money, and you're not going to get those plastics, which can give you those chemicals. Avoid plastic children's toys. Toys made of natural substances such as wood or organic materials is much better. I know that's a really tough thing to do with kids. I totally understand that. But think about it. If there's a better choice than the typical plastic chemicals, and remember, their little bodies and their little hormones are different than yours. They're much more sensitive. So don't mess with their hormones. and try to give them every chance you possibly can. Read the labels on your cosmetic and avoid anything that contains phthalates. If it says phthalates, don't use it. Avoid products labeled fragrance. That's a catch-all term which can include phthalates, which are commonly used to stabilize the scent and extend the life of the product. Avoid air fresheners. I pulled in a car wash the other day to get my car washed. And as I pulled in, the guy knocked on my window. I rolled it down. He handed me an air freshener. I said, no, thank you. And he just kind of looked at me funny. I don't want to waste their overhead. I don't want their air freshener. I'm not going to put it in my car anyway. So why take it? So if you want to use something, I know somebody called in. They didn't want to go on the air. You can use oils, essential oils. Make sure it's a pure essential oil. I love I love the smell of roses. So rose oils you can use if you want to scent something. If you want to use an essential oil, you can use a diffuser instead of an air freshener in your house, because those air fresheners, the commercial ones, usually have these chemicals in it. All right, several other ways you can minimize your exposure. Let's take a call first. Kevin, how can we make your day better? I am very well. I appreciate you calling. Thank you. Uh-huh. Sure. Sure. Yeah, chicory root's great. It's an antioxidant. It helps stimulate liver. It helps break down toxins in the liver as well. A lot of times it's used in coffee, especially from New Orleans. I don't know why, but there's chicory root coffee there, and it seems to mellow out the flavor somewhat. But the nutritional benefits, I don't drink coffee, so I don't really care about that. But it's certainly something you could add to your repertoire of good foods, absolutely. And dandelions are great too. They're bitters, and bitters can help the liver work more efficiently. So chicory root and dandelion work real well for that. Appreciate the call, Kevin. Thanks so much. All right, so folks, what do we got? We've got about 3 more minutes here. Let me get through this list real quick. And then again, if you want to make an appointment to come see us, the website is drjoe.com or 844-44-Dr.Joe. We'll get you right to the offices when we're not on the air, and we can schedule appointments in Atlanta, Duluth, and Stockbridge. We have offices. We want to get you well and keep you well. And if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. And every day almost, patients come in my office and say, Dr. Joe, I heard you say that about the car accident, and I was just in one, check me out. Then sometimes people come in and say, Dr. Joe, I was in one months ago, and boy, you were right. I had felt no pain, and then afterwards, oh my God, I couldn't believe it. And by then, guess what? The insurance companies tell you, too late, we're not going to cover anything. So if you're in a car accident, call us immediately and we'll check you out. If there's nothing wrong, hey, there's nothing wrong, go home. That's great. But don't you decide that, because you may not have pain, you're in shock, the adrenal glands are kicked in, you're pumping out adrenaline. You're probably going to regret that decision, as many, many people have over the years. So neck pain, back pain, shoulder pain, acid reflux, heartburn, nutritional advice, we want to be your doctors. So go to website drjoe.com and make an appointment right now. Or call us, 844-44-Dr.Joe. And bring your kids. Kids have health problems. Don't ignore them. There's no such thing as growing pains, by the way. If they're having pain or something's wrong, bring them in. Let us check them. And that's I wish my parents had brought. If I could change one thing in my life, of all the things that happened to me in my life, the one thing I would change is that I would have gotten chiropractic care as a child. All right, personal care products. Store them in glass containers. Once again, anything with plastic, not a good idea. Read the labels. Look for things that say PVC free, including children's lunch boxes, backpacks, storage containers. PVCs are another of these endocrine disrupting chemicals that really affect kids. Not a big fan of microwaves. And if you do use a microwave, please don't use plastic in it. I know some studies say it's safe, some say it's not. Let's assume it's safe. It's not, by the way. But let's assume it's safe. There's no risk in you not using it. There's only risk if you do use it. Vacuum and dust. I have a robot vacuum. I tell you what, I'd love to do an endorsement for these companies because I love my robot vacuum. I've been through 4 of them now, I think. When they first came out, I bought one of the first models. I've used them and burned them out. Again, I have hardwoods and tiles throughout my house. You push the button, you come home, it's done. I always said if there was only a way that it would dump its own dirt out, now they have a version where it actually sucks the dirt out of the vacuum into a container. So they've actually solved that problem as well. Love my robot vacuums. I think they're great. So if you're listening, you want me to endorse you, call my office and we'll set up a time for me to do endorsements for you. So vacuum and clean often, dust often. Don't let your house get dirty because sometimes those phthalates can collect in the dust and then it can be ingested by you and by children. Eat mostly fresh raw fruits and vegetables. Because if they're packaged in plastic, they can have things like phthalates in them. Buy products in glass instead of cans or plastic, certainly. and a bunch more. It'll be on the website, drjoe.com. So, didn't get to the end of my notes. All right, folks, if you're just tuning in, you missed an amazing show. It's going to be on the website tomorrow, 844-44-Dr. Joe, if you want to make an appointment to come see us. The website is drjoe.com. You can listen to our broadcast, order the supplements right there. Any questions you have, you can send them to me through the website as well, drjoe.com. I'm Dr. Joe Esposito. Thanks for listening. Catch you next time.
Well, here we are. The holidays are.
Almost got through the notes, but didn't quite get there. So we can say goodbye to everybody now?
Yes, we do.
Okay, goodbye, all social media people. Thanks for tuning in. Hey, folks, please share this with your friends. Let's continue keep us going as the #1 show in the country. And because of you, that's why we're there. Thanks so much. We'll catch you next week.